Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Lani de Rama. She is a registered nurse and is also the Cardiac Rehabilitation Program Manager at Washington Hospital.
So we'll talk about, again, Diabetes 101, symptoms of type of diabetes, complications of diabetes to the heart, lifestyle changes, weight loss, exercise, nutrition, and I added stress management. Just give you a snapshot of diabetes in the United States by CDC. 29.1 million people have diabetes, and that's about 1 out of 11 people, and 1 out of 4 do not know they have diabetes. 86 million people, more than 1 out of 3 adults, have prediabetes, and 9 out of 10 do not know they have prediabetes. Without weight and loss, moderate physical activity, 15 to 30% of people with prediabetes will develop type 2 diabetes within 5 years. Now, when it comes to cost, it's totaling about $245 billion. Medical costs, loss of work, wages for people with diagnosed diabetes. And as you know, medical costs for people and with diabetes are twice as high as people without diabetes. Some complications and that will lead to, if diabetes is not well managed, you may lose your vision, blindness, kidney failure, and that could lead to dialysis or kidney transplant, heart disease like heart attack, congestive heart failure, stroke, and loss of toes, feet, or legs. Online, they have a risk factor test, and it asks about your weight, having family history, and it kind of tells you about like if you have prediabetes or risk for diabetes. So what can you do? You can prevent or delay type 2 diabetes by losing weight, eat healthy, and be more active. You can manage this diabetes, work with health professionals, doctors, nurses, and then we do have a lot of nurses who are, again, offering education in the community. And again, it says here again, eat healthy and stay active. It's kind of like redundant, right? Repeating itself, lose weight, eat healthy, and stay active. For type 2 symptoms of diabetes, I mean, most of you know this already. Urinating often, feeling very thirsty, feeling very hungry even though you are eating, extreme fatigue. And sometimes that extreme fatigue prevents you from doing exercises or even just walking, blurry vision, cuts and bruises that are slow to heal. People who had a surgery also are recovering slowly because of their healing slower than normal. Tingling, pain, or numbness in the hands or feet. Early detection and treatment of diabetes can decrease the risk of developing the complication of diabetes. Again, early detection and treatment of diabetes can decrease the risk of developing complication of diabetes. So get as much, and I'm glad that you guys are here, attend all the educations that you can attend, and knowing a lot more or getting more information about how to treat your diabetes, the better you'll be in the future. Heart disease, people with diabetes, have a higher than average risk of having heart attack or stroke. These strike people with diabetes nearly twice as often as people without diabetes. There's a big link between diabetes and heart disease and stroke. In fact, 2 out of 3 people with diabetes die from heart disease or stroke. I don't think you've ever heard of people dying from diabetes, right? So it's something that is occurring and affecting your organs. Also called, again, cardiovascular disease, clogged blood vessels. If you guys ever heard of, against people having heart attack because they have clogged arteries. It says on here that also there are treatments for it, like for example, angioplasty. I don't know if you guys have heard of that, but anyway, doctors, cardiologists would go through your groin and try to open your blocked arteries with balloons. And if they can't do the balloons, they'll put a stent in it. So, or if they can't do the stent, open heart surgery. And again, there are treatments for this heart disease, stroke, and blood vessel disease. Healthy ABCs. And I think most of you know what your A1C is. And again, it's the average glucose, tells you the average blood glucose for the past 2-3 months. B is for blood pressure. So high blood pressure makes your heart work harder than it should. And you can read more about this in the diabetes.org. Your cholesterol numbers tells you about amount of fat in your blood. Some kinds like HDL cholesterol, the good cholesterol, help protect your heart. Others like LDL cholesterol can clog your arteries. High triglyceride raise your risk for heart attacks or stroke. The warning sign of heart attack. What are the warning signs of heart attacks? Become familiar with these signs. And sometimes it's really hard for diabetes to, because of damaged nerve, that you may not feel the chest pain or any pain. But there are some other warning signs. Could be discomfort, maybe heaviness on your chest. And some people, they do say that you feel like there's an elephant sitting on your chest, right? Or stabbing pain. And this pain can also radiate to your arms, back, jaw, neck, or stomach. Shortness of breath. And some of the shortness of breath and chest pain, we kind of put that together as angina. Sweating, again, indigestion or nausea, lightheadedness, tiredness, or fatigue. You may not experience all these symptoms. They may come and go. But as soon as, don't second guess yourself, as soon as you guys feel this, one of these symptoms, check with your doctor and they can, order a test. Sometimes people, they wait until a year later, a week later, a year later. But if it keeps happening, it's better to go to see your doctor to prevent massive heart attacks, damage to your heart. And again, if you have warning signs of the heart attack, call 911. So don't drive yourself to the hospital, okay? Heart failure. That leads to, from heart attack, it leads to heart failure. What this is, well, what signs that you can feel with this one is shortness of breath, weakness, nausea, fatigue, and swelling of the feet and ankles. And sometimes you'll also feel your retaining fluid in your abdomen area. In heart failure, the heart is less able to pump, so it's not pumping hard the normal way. And usually it's enlarged, and the muscle is thick, and it's not pumping, so it's not giving you circulation, good circulation. So that's why you're having like swelling of feet. You'll see swelling of feet or ankles. In congestive heart failure, another heart condition, fluid builds up in your tissues, such as in the lungs. Then breathing becomes difficult. complication of diabetes, another one, PAD. I don't know if you guys have heard of this, peripheral artery disease. And it's also called PAD. Occurs when blood vessels in the legs are narrowed or blocked by fatty deposits, and blood flow to your feet and legs decreases. If you have PAD, you have an increased risk of heart attack and stroke. It is estimated as 1 out of every 3 people with diabetes over the age of 50 have this condition. However, many of those with warning signs don't realize that they have PAD, and therefore they don't get treatment. So what does diabetes have to do with PAD? If you have diabetes, you're much more likely to have PAD, a heart attack, or a stroke. So again, if you have diabetes, you're much more likely to have PAD, a heart attack, or a stroke. But you can cut the chances of having these problems by taking care of your health. So, do what you can, manage your diabetes by, again, weight loss, eating right, and activities. And what is the risk for PAD? How do you know if you're a high risk of PAD? Just having diabetes put you at risk. But your risk is even greater under the following conditions. Especially if you smoke, high blood pressure, abnormal blood cholesterol levels, overweight, not physically active, over age 50, history of heart disease, or family history. You can't change your age or your family history. And they always say you can't change your parents also, or trade in your parents, right? But taking care of your diabetes and the conditions that come with it can lower your chance of having PAD. And what are the signs of PADs? Many people with diabetes and PAD, they don't feel the symptoms. Many experience only mild leg pain or trouble walking, believing that it's just a sign of getting old. Others may have the following symptoms. Leg pain, particularly when walking or exercising, which disappears after a few minutes of rest. And if you have been doing like a lot of activities before, walking, and then maybe the day after or a week later, something changed, right away, go see a doctor. Numbness, tingling, or coldness in the lower legs or feet. Source of infection in your feet or legs that heal slowly. What is stroke? A stroke happens when the blood supply part of your brain is suddenly interrupted. So most strokes happen because a blood clot blocks a blood vessel in the brain or neck. A stroke can cause movement problems, pain, numbness, problems with thinking, remembering, or speaking. Some people also have emotional problems such as depression after a stroke. What does diabetes have to do with strokes? Again, it says here, if you have diabetes, your chances of having a stroke are 1.5 times higher in people who don't have diabetes. But you can lower your risk by taking care of your health. Risk for stroke, age of 55, over age 55. You have a family background is African American. You already had a stroke or transient ischemic attack, or TIA, a mini stroke, or a history of stroke or small strokes. You have a heart disease, high blood pressure, again, overweight. So everything is repeated. You have high LDL, that's the bad cholesterol, low HDL, good cholesterol levels. Again, you're not physically active, and you smoke. You can change some of these risk factors, but you can lower your chances of having stroke by taking care of diabetes, tackling some of these risk factors, such as losing weight. If you're overweight, it's really up to you. You're the only one who has control of your health. So how can I lower my risk of having stroke? Lower your risk by keeping your blood sugar and blood pressure, cholesterol on target with healthy eating, physical activity, and if needed, take some medicine, again, prescribed by your doctor. If you smoke, quit. Every step you take will help. And I know that smoking is very difficult, but if you can, do it. The closer your numbers are to the targets, the better your chance of preventing stroke. Warning signs of stroke. Typical warning sign of stroke develops suddenly and can include weakness or numbness on one side of the body, sudden confusion or trouble understanding, trouble talking, you're slurring, dizziness, loss of balance or trouble walking, and trouble seeing out of one eye or both eyes, double vision, severe headache. If you have warning sign of stroke, call 911 right away so you get proper treatment as soon as you can, because you don't want a permanent damage to your brain. Okay, exercise recommendation. So we're going to talk about exercise and about cardiac rehab, what we can do for all diabetics. New exercise guideline per Department of Health and Human Services. Goal is to get 150 minutes a week of moderate vigorous activity, 75 minutes vigorous activities. And there's a subtle changes. Before you say, do 1 hour of exercise. But now what they're saying is that do 10 minutes and you can split them up, right, throughout the day. And especially if you love to watch TV, you can do some in between during commercials, right? So anything you can do, get out of the house, enjoy the outdoors, but stay active. And incidental physical activities, what that is like a burst. So you have a workout, right, regimen, just by going hiking one morning or going shopping, right, with your family and friends. Something like that. That's what it means, burst of activity. In addition to your workout, can make a difference. Strength training is very important also. As we get older, we tend to lose our muscle mass, and that leads to falls. Make it challenging to get out of cars, open jars, stand or playing with your kids or grandchildren. And data shows that 70% of 70 years old can't get off the floor. I say it over here, routine, give yourself an hour a day to exercise. High level running, biking. Moderate level jogging, biking. Low level walking. And again, here I put down modified with walker or cane, whatever you can do to just go ahead and go for a walk. When watching TV, like what I said earlier, to get up every 15 minutes during the commercial. And indoor versus outdoor. And it's just it depends on what you like to do, safe or to be in, for safety reason and for weather. And now for indoor, there's a lot of places where you can go. You can go to the gym. And I would like to give you guys some information about cardiac rehab here at Washington Hospital. You can do some walking in the mall and in your house. Outdoor, maybe go out, walk around Lake Elizabeth, right? And in your neighborhood. How can we help diabetics by coming to cardiac rehab? We have cardiac rehab. We're open Monday, Wednesday, Friday. We have classes throughout the day. You will feel very safe. Basically, we have professionals like registered nurses and exercise physiologists who basically care for all our patients. We show them, we guide them how to use equipment upstairs. Our exercise physiologist does a group weights and doing balance and everything else. So when it comes to nutrition class also, we do have that too. And what's so nice about it too is that with cardiac rehab is that we have all the diabetics take their blood sugar before and after exercise. By knowing their numbers, they can tell what they're doing, correctly. Meaning that what they're eating before they exercise or throughout the day, the numbers, it will tell you. We do education with everything, really. How, with eating, diabetes, But one thing though, on top, it says physician referral needed. I do have a form in the back that the doctor can prescribe, or a prescription that he can fill out, so you guys can start cardiac rehab. You know, I added this one. When you're first diagnosed for diabetes, you know, you're referred to a diabetic educator or to a clinic. Referral to a dietitian. I'm hoping that you guys take advantage of this. An ongoing diabetes education in the community and following up with your physician hematologist. Another thing also I wanted to include is that referring to cardiac rehab. It's underused, meaning that there's not that many diabetics who are referred to us, but we would like to see more. So we talked about and understand about the problems and symptoms of diabetes and what diabetes can lead to heart disease. So lifestyle change, utilize the community resources that we have here in our community. Exercise, you know, the diet, take all your medication, Community resource, exercise, diet, take all your medication and follow up with your physicians. It's a lifestyle change. But we have this, I don't know if you guys have received this, but a lot of information about different education that Washington Hospital offers. So take one. Washington Hospital services available, like cardiac rehab, women's center, ladies' choice. And if some of you women who would like to exercise only with women, that would be a good one. Tai Chi, Pilates, and they have nutrition class, diabetes class, and some other rehab. I added this one. Exercise not only changes your body, but it changes your mind, your attitude, and your mood. 2019 is the year for whole body and health. I like this one, be mindful what you eat, what you put in your mouth, what you do in life. And set a goal what you want to do and how you want to spend the rest of your life. Stay active. You want to stay independent. And that's it. Thank you.